This, this is your first and only warning. Ignore this, and a bedsore is around the corner. Do you know that bedsores are formed within 2 hours of lying in the same position? Earlier this year, I admitted a lady who presented with bedsores. We could smell the bedsores from the time she entered the compound. When I opened the bedsore, especially the one to the coccyx area, the tailbone, it is difficult for me to even describe how I felt. I was hurt. I was angry. I couldn't believe what I was seeing. There was no butt. There was just a big gaping hole where you saw the bone. The area was black and necrotic and pussy. When we opened the sides, both sides, you could have seen the hip bone. I couldn't help but cry. Which is unusual for me. But I was very angry because bed sores, any bed sore, is 100% preventable. She was made to suffer because of neglect and lack of knowledge. That made me realize that I had to now come and deal with how do we prevent it and how do we treat it. Let's go. Come with me. It is very important to recognize when there's an issue and then to in order to prevent it. So let's look at how do we prevent. One, we recognize that the skin over the bony prominences become red. It can be swollen. It is non-blanching, so that what it means is when you press your hand or any pressure onto the red spot, it does not move. The redness remains. So we know that there's inflammation and tissue destruction under that. Warmth. Put your hands and feel it. It can be warm. It can be hot to touch. It might be swollen. When you touch it, the person is in pain. They may not be able to say they're in pain. If you look at the facial countenance, you may see grimacing. They might pull away the limb. They may tell you, don't touch it. So you know that something is definitely wrong in that area. There might be change of color of the skin. It can become ashy because the tissue is dying because of the pressure exerted onto the skin or the bony area. Texture changes. It may feel soggy underneath that area. It may feel a little tough. It may feel soft. It might be brittle or fragile. So you know that something is happening in that area and we need them to intervene immediately. So we recognize, okay, something is wrong. There is a stage 1 bed sore. Treatment. 1, turn your patient every 2 hours. Side, back, side, back. Ensure that there's no friction between the limbs so that there's no continuous irritation and breaking where you turn that limb over the other limb. 2, gently cleanse the area. Do not go rubbing at it and make it and scrub at it. You need to very gently clean the area and keep it dry. So if it's in the coccyx area or the hip area where you have diaper, urine, and stool, that needs to change immediately. As soon as it is wet, you change it, keep it dry. We have scheduled 2 hourly rounds at my nursing home. So every 2 hours, diapers are checked and changed immediately. There's pericare, and they are turned every 2 hours and recorded so that we know, well, okay, if they were in this position 2 hours ago, then the other nurses who is coming in for continuity of care, the other nurse who is coming in will know that she has to change in the other position, the opposite position. Okay, so we've tried our best to prevent the bed sore, but we recognize that there is redness in an area. Our aim then should be to prevent that stage 1 bed sore from going to stage 2 and 3 and 4. That is where it goes deeper into the subcutaneous tissue, so it burrows into there. Then the pressure continues and it goes into the muscle, so the muscles are now affected. And then what happens, it can actually begin to go where you're seeing the bone. So we don't want that to happen at all. We don't want that level of suffering and pain on any human being, especially with our elderly persons. So we begin treatment. One, you ensure as soon as you recognize there's an issue, let your doctor or your nurse practitioner or your nurse in charge know that there is a problem, you've seen this issue, and it should be addressed. 2, you may need to get medical cleansers like normal saline or whatever your doctor or nurse recommends that it be cleaned with, and it should be cleaned gently and thoroughly, exactly as ordered. You can also use prescriptive drugs, drugs that doctor order. Yes, it might be powder form, it might be antibiotics, we do not know, but whatever is recommended, it needs to be used. And this is not a quick fix. This, because the skin is now damaged, it will take a while. So you need to continuously and consistently apply your dressings and even your outer layer of cushion so that the bed sore does not progress to stage 2 and 3 and 4. Yes? Record and report clearly on a daily basis and continuously observe that wound. Look at the outer sides. See if there's any ring of darkness around or further swelling. It means that the pressure still has not been relieved and you go into this wider area. Another thing you can do is use your pressure gadgets. You have ripple mattresses, you have air mattresses, we have cushions that can be used, donuts that can be used to relieve that pressure so that 1, it doesn't happen at all, and 2, if it does occur, then it can be prevented from becoming worse. And remember, please remember, we need to use our eyes, our hands, and our voices to help in preventing and treating bed sores.